looking at the overlap between trauma and ADHD, we see a lot of challenges with executive dysfunction for both of these groups, right? You can't get certain stuff done. You can't activate to do the thing. You maybe lose track of time. Maybe you're disorganized. Maybe you have trouble paying attention, staying present. All of these things. So we see some overlap here in terms of not being able to, access the executive functions. Um, but I always encourage individuals to check in with yourself. How do you feel in the room? Because pure trauma, or if you're talking with someone with ADHD and the source of the challenge is the trauma, it's going to feel different. It absolutely feels different. And so the question is, why does it feel different? Like if you're sensing something in your body and you're sensing something in your head of like, this doesn't click, like this doesn't feel right, in terms of it being ADHD, right? Or in terms of it being like driven by the trauma, we really want to check in with that. And so part of the reason it can feel different is because your brain is maybe picking up on some of the antecedent conditions that are giving rise to the challenge in the first place. So with trauma, we have an activation of the amygdala. And remember, with trauma, as I know you guys know, we have a hypervigilant amygdala. It's just extra, extra sensitive. And so when you get activated, right, something happens that triggers you, your amygdala gets activated, and that prevents access to the prefrontal cortex. This is true across the board for everybody. If you are in a stress state, your amygdala fires up and your prefrontal cortex essentially shuts down. The goal is to get out of harm's way and to survive. It doesn't matter how or when, but the goal is to try to stay safe. So this is going to happen for anybody who's in a dangerous event, right? But for trauma, it's an event that likely isn't dangerous, but our brain picks up on something in the environment that was similar to maybe the trauma in the first place, and so it's extra sensitive. It gets kicked on and we lose access to the prefrontal cortex. So in conversation, really digging into what is going on. Was there a trigger? Was there like some negative event that then kicked on, the amygdala, and therefore they can't show up the way that they need to show up, or they lose track of time, or whatever the executive dysfunction is presenting as. With ADHD, it's about inconsistent access to the prefrontal cortex due to inconsistent access to dopamine and norepinephrine. So with ADHD, what gives rise to the executive dysfunction, or really the inability to access their executive functions, is due to not having access to dopamine or norepinephrine. And the things that would give someone with ADHD access to dopamine and norepinephrine may include like medication as an example, but also certain conditions under which their brain operates optimally. And so it's really digging into what is going on with that individual. Are they triggered? Or are they in a situation that is incompatible with how their brain works and therefore preventing them from having appropriate levels of the neurotransmitters that they need in order to do that thing? And this is why we can often think about ADHD as being consistently inconsistent.